Hi, I'm Joshua Z, student number 0185387. I will be doing a TRT analysis today and mock adjustment on priorities 1 through 3. This is Londi, my assistant
Hello.
for the day. Go ahead and lay down for us. First thing we want to do is make sure that the patient's laces are touching the base of the table and that we have an increase in foam at the base of the table to help elicit the functional leg length reflex, which we will be doing right now to look for the short leg. In this case, the short leg presents on the left. First thing we're going to do is look for a cervical syndrome. So I'm going to have the patient turn their head to the long leg side. In this case is the right. Elicit the reflex again. We're looking for the legs to balance. If they did balance, it could be one of two things. Patient, can you go ahead and turn your head to the center? And to see these, we are going to pressure test. So we're going to pressure test C1 on the posterior arch with positive or negative torque. If that balances the legs, we will then challenge and see if it unbalances the legs. Also C5 with positive and negative torque. If that balances the legs, we will challenge, which would unbalance the legs. The adjustment for these areas at C1 will look like this: P to A, I to S, with whichever torque you find balances the legs. Same with C5, P to A, I to S, with your finding torque. If turning the head to the long leg side did not balance the legs, we will continue by turning the head to the short leg side. So Lonnie, can you go and turn your head to the left, please? This is the reflex. If this balances the leg, then the listing is a lateral atlas. So that would be C1, pushing lateral to medial for the pressure test. If this balances the legs, we will challenge. You also have positive and negative torque as a component in this listing. The adjustment at C1 will be straight lateral to medial. If the legs balance upon rotation to the long leg side and rotation to the short leg side, what we are looking at would then be occiput, posterior inferior, which we can pressure test. If this balanced the legs, we would then adjust P to A, I to S. If this was not the listing, then we would check for coccyx. Is it okay if I contact the bone that you sit on?
Or this?
Pressure test for coccyx. If this balanced the legs, we would then adjust the coccyx. Is that okay if I touch the bone that you sit on?
Yeah.
Which is A to P and I to S. Immediately after adjusting coccyx, we have to adjust the sphenoid. So we will find which plane the sphenoid needs the impulse. So go ahead and keep your head to the center.
Oh, sorry.
We're going to check the 4 planes, so we would check south. Come down here and recheck. If that didn't elicit, I would go on to east, north, west. Depending on which one you find balances the legs, patient, you can go ahead and turn your head to the left. We are going to tissue pull in that direction. Place the integrator backed up on our finger and impulse in that direction. Head back to center. If after that adjustment, or after all adjustments, we're going to clear the screen. We also, with the bilateral cervical syndrome, it could be a posterior C5, which we will pressure test and check for torque. We've already seen that adjustment. And posterior C1, which we will pressure test, look for torque, and challenge. And we've already seen that adjustment. It could also be T6, which we will pressure test, check for positive and negative torque, and challenge to confirm. The adjustment for T6 will look like this. Or and lateral C1, which we will pressure test, check torque, and challenge. And we've already done the adjustment for that one. That is the end of category 2, and then we'll proceed to category 1. Category 1, functional labeling challenge. We're going to check for a lateral occiput, if this balances the legs, the line of drive for the adjustment will be lateral to medial. After checking occiput, we would proceed to checking sacrum on the short leg side. If this was positive, we would then check for the segments of sacrum to see which sacral segment precisely needs the impulse. Once we find that, we will check for torque, and the impulse will look like this on whichever sacral segment you find. After that, we would then proceed to coccyx and sphenoid, which we did in Cat 2, but I will demonstrate again. So is it okay if I touch the bone that you sit on? Mm-hmm. We would then pressure test. If the leg's balanced, we would adjust. I'm going to contact the bone that you sit on. A to P, I to S, and then I would immediately then go and check the sphenoid while checking the feet, and we've seen the adjustment. Turning it to this side would look like this. Back to center. And lastly, we have priority 3, which is the Deerfield priority. Find the short leg, and then we are going to flex the knees and dorsiflex the feet. And we're looking to see if the short leg becomes long or stays short. If we have positive in this area, it would be a number of things. We can have an AI sacrum. I'm going to contact the bone that you said on. Is that okay? Mm-hmm. So we're going to pressure test the sacrotuberous ligament. And the adjustment would be in the same area. I to S, A to P. We could also have a AS trochanter. So for this, we will pressure test. This moved anterior and superior, so we're going to go posterior and inferior. Look at the legs. The adjustment for this, if it were to balance, would be in the same direction as the pressure test. After checking for the trochanter, we are going to check for a PI ilium. So we'll just pressure test on the PSIS, check the legs, and then we can also challenge this in the opposite direction to see if it would exacerbate the leg length difference. The adjustment for this will be just on the PSIS, P to A, I to S. And lastly, this could be a superior pubic rami. So to test for this one, Londi, could you go ahead and squeeze your knees together for me and relax? Okay, and if this were to balance the legs, can you go ahead and roll over for me? And you have to remember that the short leg side is going to switch when the patient rolls over. So you want to make sure you switch sides for the adjustment. Can you go ahead and do this with your hands?
That was a long end delay.
Yeah. Go ahead and place that in your belly button, good. And you should feel a bone down near your fingertips. It's your pubic bone. I'm going to contact just above that. Is that okay? And the adjustment for this is A to P and S to I. That is it.
Good job.